Good afternoon and welcome everyone to today's cough and congestion microlearn. We're gonna start at 12 noon. So we'll give it a few minutes here and wait for the rest of our colleagues to join us. In the meantime, please feel free to fill out the pre-session survey, which is located in the chat. The link. So we'll get started. This session is part 4 of 5 brought to you by Project Firstline Rhode Island under the Rhode Island Department of Health in partnership with the CDC. And again, once more before we begin, if you could fill out that pre-session survey, Abby Anderson, who is our Project Firstline Rhode Island assistant, is showing that link in our chat. And the Project Firstline team is behind the scenes in support of this webinar. And if you'd like to enter, put down your name and where you're from in the chat or your email, that'd be great. And for those of you who are returning, it's great to see you. And those who are new, welcome. My name is Lisa Ledoux. I am one of the infection prevention training liaisons for Project Firstline Rhode Island. And today's microlearn, we're going to review infection prevention and control actions that you can take to keep you and your patients safe when you see someone with cough and congestion. This session is just about 15 minutes. And if we have any questions, we'll answer those at the end. So we'll begin. Again, today's microlearn is cough and congestion. What should you do when you see a patient with cough and congestion? And I'm going to break down key points of a microlearn and show you how to use it in your workplace and how you can share it with your team. Before presenting a microlearn, check with the policies and protocols at your facility and adapt the content accordingly. Incorporate microlearns into existing opportunities where groups of healthcare workers gather, such as a pre-shift huddle or team meetings. The session should be led or facilitated by an experienced team member with infection control expertise. And the microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment, not necessarily in visitors or other staff members. And if a team member witnesses a patient in distress, such as shortness of breath or bleeding, they should respond to the emergency per facility protocols. And here's our agenda for today's session. We did our welcome and introductions. We're going to next go over the learning objectives, discover what a microlearn is and review talking points, what to do if you are near a patient with cough and congestion, infection control actions to prevent the spread of respiratory viruses. We have some key takeaways and end of session feedback. So here are the learning objectives for today's session. Identify symptoms associated with a respiratory virus. Recognize the risks when you see a patient with cough and congestion. And know the infection prevention and control actions to take when you are near a patient with cough and congestion. The Project Firstline Infection Control Microlearns are a series of guided infection control discussions that provide brief, on-the-job educational opportunities. And Abby will show the link for you to see our 5 microlearn resources. Each microlearn focuses on a single infection control topic and connects infection control concepts to immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. Each microlearn contains a discussion guide, which you can see on your slide on the screen right there. Pictured on the left is the discussion guide, and on the right is a job aid that the facilitator can use to guide the discussion and use these as resources. And I'm going to break down each of the talking points in the discussion guide as we go through cough and congestion. So you want to use these talking points along with the job aid to engage your team. We're going to go over, introduce the topic, expand on the topic, discuss with your team, and then we'll wrap up and reinforce. So first, we're going to introduce the topic. And again, today's microlearn is cough and congestion. Coughing by itself can be caused by a lot of things, but a cough in combination with congestion, a stuffy nose, a runny eyes, or a nasally voice is commonly caused by bacteria or viruses. Some examples of bacterial respiratory infections are Pseudomonas, Streptococcus, MRSA, and pertussis. And some examples of viral respiratory infections, flu, RSV, and COVID-19. These respiratory infections spread easily when an infected person talks, breathes, coughs, laughs, or otherwise blows air out of their nose and mouth. One person releasing these germs into the air can infect multiple people quickly. And some respiratory infections do not cause major problems for healthy people. However, these infections can be very harmful to those that are immunocompromised. When an infected person talks, breathes, sneezes, or coughs, they produce respiratory droplets that can spread germs. Germs in the nose and mouth can spread to the skin and hands when people touch their faces, which can then spread to surfaces and other people. Viruses are more likely to spread in places with poor ventilation or areas where there are many people crowded together. Health outcomes for healthcare workers and patients improve when coughs accompanied by congestion are identified quickly. So, our second talking point is when we expand on the topic. What are things that you should know and what you can do in your healthcare role? So, you can help stop the spread of germs by performing these infection control actions. Ask the patient to wear a mask and explain to them, but by them wearing a mask, that they're going to prevent their germs from reaching you and others. If it's safe for them to do so, if they're over the age of 2 and they're able to remove that mask on their own, if they ever needed to. If you're near a patient with cough and congestion and don't know what's causing their symptoms, you can protect yourself from breathing in infectious particles by using a face mask and considering use of an approved respirator according to your facility policies. And as soon as possible, the patient should be placed in a separate room away from others. You want to check that air vents in the room are not blocked, as this could prevent the ventilation system from working properly. A vent could be, blocked by a chair or a trash can. You want to clean your hands, wash your hands properly and thoroughly, and avoid rushing this task. Approximately 1/3 of infections are preventable by performing hand hygiene. And last, clean and disinfect surfaces and shared devices. Preparation is key. Familiarize yourself with facility protocols, triage, and screening procedures for patients with respiratory viruses symptoms. Second, know where to find respirators and PPE. And last, know who to call if those supplies are running low and need to be restocked. Here are great posters. One is on germs can live in the respiratory system, and the other poster is what to know about ventilation in the healthcare setting. And you are all going to have these links to all these resources that I've been showing to you this afternoon. They'll be sent to you, they'll be emailed to you. Our third talking point is find out how your audience feels about the topic. There's a lot of questions that you can ask your team or your staff and see how they're understanding this. And here are some questions to ask them. So at this time, I invite you, if you want to participate as I go through the questions, if you'd like to put some of the answers in the chat. Okay, first question. What do you usually do when you see a patient who is coughing and has congestion? So if anybody wants to participate, sidestepping and leaning away from someone who coughs or sneezes is an instinct to avoid exposure. Okay, you want to provide a mask, right? Provide a mask to the patient and then also put one on for yourself for your own protection. Another question, do you worry that you might catch something? It's normal to worry about getting an infection. We know some infections can cause harm to people who are immunocompromised. So you can decrease that worry by getting sick when you know what infection prevention and control actions to take to protect yourself, your patients, your coworkers, and your families. Another question, when might you call for help or assistance? There might be a situation where the patient may not be able to wear a mask. You may need help from a coworker or management to find that private room for this patient. Another question, as a team, how can you help each other take the right infection control actions when you see a patient who is coughing and has congestion to keep germs from spreading? So we said masking is the first important infection control action that you can do as a healthcare professional. Check and make sure that your coworkers have their proper PPE on. Are they performing proper hand hygiene? And lastly, do you have all the tools and information that you need to do your job safely? Do you know where to get that PPE? Make sure you know who to contact, if supplies are running low. Also, did you check, did you perform the proper infection control actions to prevent infection? Did you check the vents in the exam rooms? Make sure they're not blocked. and also assuring that all shared equipment and high-touch surfaces are cleaned and disinfected. And our fourth talking point, this is where we wrap up and reinforce what we just reviewed in the microlearn. So reminder, if you are near a patient that has a cough and congestion, wear a mask to help stop the spread of germs. Keep each other safe and healthy by wearing a mask. Key takeaways. So we know that if we learn how to identify symptoms associated with a respiratory infection, we can work to prevent the spread to others. Respiratory infections easily spread when an infected person talks, breathes, laughs, coughs. If you are near a patient that has cough and congestion, wearing a mask, cleaning your hands, cleaning and disinfecting surfaces and equipment are a few infection control actions that you can perform to stop the spread of a respiratory infection. And here are the references that are used for today's microlearn session. And I know this was quick. These microlearns are quick. That's the whole purpose of them. So at this time, I ask you if you could please take our end of session feedback poll. This will help us to improve future training sessions and for your learning needs. And if anybody has any questions, please feel free to put it in the Q&A box if you have any questions at this time. And if you did not put your email in the chat earlier, please do so if you want to be on our email distribution list for our future webinars. This Thursday, September 26th at 12 noon, it's going to be our last microlearn session, and I will be presenting again, and it's going to be what do you do when you see diarrhea? That'll be our last microlearn. We presented 5 of them. That'll be our 5th, and we have presented them all in the month of September. And then also in alignment with today's cough and congestion microlearn, as we enter respiratory season, I will be presenting infection control reminders for healthcare workers during respiratory virus season on October 7th at 12 noon. It's a 45-minute refresher session, and I'm going to discuss the respiratory viruses that we will expect to see circulating this respiratory virus season. And, come learn how you can protect yourself, your patients, your coworkers, and please feel free to share with your friends and colleagues and have them join you. And that, again, will be October 7th at 12 noon. And if nobody has any questions at this time, please go have a great afternoon. And I thank you very much for joining me today. And looking forward to seeing you on Thursday.